Hi everyone. Today we're diving into two health conditions that are often connected but not widely understood: postural orthostatic tachycardia syndrome, or POTS, and Ehlers-Danlos Syndrome, or EDS. We'll break down each condition, explain how they're related, and offer a bit of hope to those managing both. Let's start with a brief overview of POTS and EDS. POTS stands for Postural Orthostatic Tachycardia Syndrome. It's a type of dysautonomia, which is a dysfunction of the autonomic nervous system, the system that controls many bodily functions without us even thinking about it, like heart rate, blood pressure, and digestion. People with POTS experience a rapid increase in heart rate when they move from lying down to standing up. This jump can cause symptoms like dizziness, lightheadedness, and fainting. It can make standing up or staying upright for long periods very uncomfortable and sometimes even debilitating. This condition is more than just feeling a little dizzy. It can impact daily life, making it hard to work, socialize, or even complete simple tasks. In fact, many people with POTS need to plan their activities around their symptoms. Now, let's talk about Ehlers-Danlos Syndrome, or EDS. EDS is a group of genetic connective tissue disorders. Connective tissue is essentially the glue that supports and holds our body structures together. In EDS, this tissue is weakened, leading to symptoms like hypermobile joints, fragile skin, and in some cases, frequent dislocations or injuries. There are several types of EDS, but one of the most common is the hypermobile type, often referred to as AEDS. People with AEDS experience joint hypermobility, meaning their joints can extend beyond the typical range. This can lead to joint instability, pain, and other issues. EDS can impact many areas of life, and just like POTS, it varies widely in severity. Some people may only have mild symptoms, while others face significant challenges due to pain, joint instability, and other related issues. So what's the link between POTS and EDS? Studies suggest that there is a notable overlap between the two. Estimates indicate that about 25 to 50% of people with EDS also have POTS. The exact reason for this connection isn't fully understood, but there are some theories. One theory involves blood vessel elasticity. Connective tissue isn't just found in our skin and joints, it's also in our blood vessels. For people with EDS, weaker connective tissue might make blood vessels more prone to dilation or stretching. When blood vessels don't constrict effectively, it's harder for the body to pump blood back up to the heart and brain when standing, which could contribute to the symptoms of POTS. This means that people with EDS might experience POTS because their blood vessels aren't as efficient at regulating blood flow, especially when they change positions. Another theory suggests that changes in the autonomic nervous system might play a role. Some research shows that people with EDS may have nervous systems that are more sensitive to changes in blood pressure and heart rate. This can lead to a heightened response when shifting from lying down to standing, causing POTS-like symptoms. So in a way, the body overreacts to the change in posture, causing that rapid heart rate and dizziness we associate with POTS. For those living with both POTS and EDS, daily life can be challenging. Symptoms often overlap, and treatments are sometimes aimed at managing one condition at a time, rather than both together. Common treatments for POTS include staying hydrated, wearing compression garments to improve blood flow, and increasing salt intake to help with blood volume. Some people also find medication helps manage heart rate and blood pressure. For EDS, management usually involves physical therapy to strengthen muscles around the joints, pain management, and sometimes even bracing to support unstable joints. It's important for those managing POTS and EDS to know that they're not alone. Support groups, both in person and online, can be a great resource. Sharing tips and experiences can make a big difference in finding ways to manage symptoms and stay positive. Living with conditions like POTS and EDS can be overwhelming, but understanding the connection between them is a powerful first step. It can help guide more effective treatment, lead to better symptom management, and importantly, provide a sense of community and support. Thank you for watching. If you found this video helpful, please give it a thumbs up and consider subscribing for more content on chronic health conditions. Remember, you're not alone on this journey. See you in the next video.